I'm Dr. Palwani. I'm a GP and a clinical lecturer based in Northwest London. I'm also a clinical champion working with Public Health England, and I'm an examiner for both undergraduate and postgraduate doctors. So I was fortunate to get into my first choice of medical school, which was Imperial College London. After 6 years, I qualified as a junior doctor, and I went down to Brighton for 2 years to do my academic foundation program. During that time, I decided I wanted to specialise as a GP, so I returned back to London. I did additional training in accident emergency, cardiology, paediatrics, and after 3 years, I qualified as a GP. So there's not been any 2 days in my career which have been the same. Every day presents with its own unique challenges which we need to be able to tackle. The clinical days are very busy. We see a wide variety of patients, from babies who are unwell with skin problems, with feeding issues, through to adults who might have mental health issues or cardiovascular problems, and we see the elderly population who might have more complex chronic illnesses which we need to be able to manage in conjunction with them. I think what I enjoy most is a huge variety of problems that we see on a daily basis, and being able to think about how best to investigate the problems, how best to treat these different problems, and what further specialist input might be needed. This variety is what keeps things really interesting in general practice, and it allows us to develop all our skills that we have been prepared for. I think what's really challenging is not knowing what's going to come through the door. So you cannot prepare for the things that you might see or come across in general practice. Anything can come through the door, and you have to be prepared to think about whether it's a cardiovascular problem, a respiratory problem, a mental health problem, whether it might be a dermatological problem, and there might be multiple problems. So being able to tackle these various issues together is something that is quite challenging, and something that we get better with the more experienced we become. So the decisions we make involve what investigations to order for our patients, so various blood tests or scans such as x-rays. We have to think about the treatment options which we do in conjunction with our patients, and we also have to think about whether they need onwards referral to see a specialist. We also make decisions alongside other professionals such as social services, clinical pharmacists, and so on. So many people aren't aware we'd actually been working virtually even before the pandemic started, so we were offering telephone consultations. What the pandemic's done is it's accelerated the transition of using more virtual consultations in the form of video consultations. We've also got the ability now to allow patients to text us pictures of, for example, skin problems, which we're able to manage and diagnose. Now this is something that's actually been very well received amongst the patients who use the service. I think what excites me the most is being able to apply all the skills and training we've had over the past many years to become doctors. So being able to use our skills of empathy, our communication skills, being able to think about the best investigations to order, the best treatment options to offer our patients. And I think that's something that's really rewarding on a daily basis for us. So we learn things every single day in our work. We're learning about the latest medical developments, how best to treat problems such as diabetes, the latest investigations that we can offer, and we also learn from our patients and how best to interact with patients who might be a bit averse to receiving healthcare, and how they interact with the services we offer and the NHS as a whole. I think it's the realization of a certain skill set and personality that you need to succeed as a doctor. So it's really important to have certain attributes such as being empathic, being able to listen carefully to the patient in front of us, being really inquisitive and trying to understand exactly what's going on in this patient and how it's affecting them, and also being able to apply the knowledge and skills we learned throughout medical school to offer the best treatment to our patients. So as a doctor doing baby clinics where we check the 6 to 8 week baby check, I learned very quickly earlier on that babies have a very low threshold to passing urine while being examined. So I learned that mistake pretty quickly, and I made sure from that point onwards, whenever I examined babies for the baby checks, I'd always wear an apron and gloves to help deal with this problem. I'd recommend it wholeheartedly. You get to learn a lot from the work you do, you get to really make a difference, and you get to work alongside some amazing colleagues, both within your practice and the wider NHS. So I'd say get on board, get some experience, and I think it's a decision that you'd really, really appreciate in the long term. I think it's the realization that just because you become a doctor, just because you pass your exams, that's not all the learning you'll ever need to do. Learning is a lifelong experience. Things change quickly in medicine. The treatment options we offer for diabetic patients, for example, has changed completely in the past few years. The investigations we do for someone with suspected cancer has also changed completely. So it's awareness of needing to learn constantly and keep on top of the latest medical developments.